Hi, and welcome to laboratory testing. This is the online presentation of Chapter 7, which is the chapter on immunology. Now, the first thing that we're going to do before we get started on Chapter 7 on immunology is two things. First, we're going to do some review slides dealing with Chapter 6. These slides can be really useful to you to use as a way to study. Because this presentation is online and recorded, you can pause, rewind, and you can look at it several times to help yourself study between now and the time of your final. So I hope that you use these review questions on Chapter 6 in a way that will help you prepare for any questions you may have dealing with Chapter 6 on chemistry. I know everyone has already read Chapter 6 on chemistry because we have almost finished that chapter in the classroom. Remember, always read the chapter before you come to the classroom for lecture, as you do not want that to be the first time that you hear the information. It helps the class be more interactive, because if you have some basic knowledge by reading that chapter, then when I am lecturing in class, you can be more involved and be able to answer questions and make it a more enjoyable experience. So your textbook for laboratory testing is a great textbook, and Chapter 7 on immunology starts on page 180. So before we dive into Chapter 7, let's go through some review questions for Chapter 6. Okay, guys, before we get started with these review questions for Chapter 6, a few things I want you to know. First, get out your black light binder and turn it to the review questions or the study guide questions for Chapter 7, not Chapter 6, Chapter 7. Also, get out your textbook and turn it to page 180, just because we're going to use that as a little bit of a visual tool. I also want you to have a blank piece of paper out, because don't have your textbook or your study guides turned to Chapter 6, because I really want you to test yourself on this. We've already covered almost the entire Chapter 6 in lecture class, and I want you to test yourself to make sure that that information you're learning by both reading Chapter 6 in your textbook and sitting in lecture as we go through the presentation for Chapter 6, to make sure that that stuff is sinking in, and then you can catch any areas where you may be weak. So get out a blank piece of paper, put a 1 there, and then I'm going to read the question. Okay, I know you guys can read, but the reason I'm going to read it is because that'll give you time to pause it while I'm reading, read it yourself, answer the question, and then start it back up and see if you get the right answer. It's kind of like flashcards. So let's try it right now. So if you need to, pause this presentation right now, get your book, get your black binder, and get a blank piece of paper. Okay, so let's start here. Which of the following is not a lipid test? HDL, LDL, total cholesterol, or hemoglobin A1C? Hemoglobin A1C, right? We know that hemoglobin A1C is the test that we use to diagnose, monitor, and treat diabetics or diabetes mellitus. So how can an individual increase their high-density lipoproteins or HDLs while at the same time lowering their low-density lipoproteins or LDLs? Which test value is the best predictive indicator that a MI or myocardial infarction is about to occur? Your cholesterol HDL ratio. Remember, your HDL high, like high grades are good, right? Your HDL is your good cholesterol, and we want more of your total cholesterol to be made up of that HDL. Okay, because that ratio is going to be the thing that helps doctors predict your risk of heart disease or a heart attack. What does a high glassyladed hemoglobin test value mean? Remember, the lifespan of those red cells, right? 2 to 3 months, 120 days approximately. During that time, they coat that hemoglobin molecule, and that's what we're testing for in that hemoglobin A1C. Which of the following will not cause the quality control to be out of range? the package directions for the last test were not followed, or the patient did not follow a healthy, low-fat diet prior to testing. Okay, this question is one of those questions to make sure you can critically think through things and fully understand what quality control was about. The patient not following a healthy diet has nothing to do with quality control, right? It will affect their test results and their health outcomes, but quality control, as we know, is a known sample that we use to test our technique, our instruments, reagents, strips, all those things to make sure that our test and testing techniques are working properly. And if we did not follow, okay, the package directions for whatever instrument or testing device or testing package we were using, that can cause our quality control to not be working. So which food is not limited prior to beginning an occult blood test? Aspirin, anticoagulants, eggs, red meat, bananas, or turnips. Eggs, okay? Eggs are the only food that is not limited prior to an occult blood test. And as a lab assistant or medical assistant or a phlebotomist, you may be tasked with the job of communicating this information to your patients prior to them coming back in for testing. Glucose levels in the bloodstream must be maintained at what amount? 70 to 110 milligrams per deciliter. Now, you may see some bit of a fluctuation in these normal reference ranges for glucose, things like whether there's a random glucose, fasting glucose, what part of the country it's in. It could vary, but it's pretty close to this most of the time. Are lipids or carbohydrates broken down into fatty acids in the liver? Lipids. Remember, carbohydrates are stored as glycogen in your liver and in your muscles. What is the part of the instrument that measures the intensity of light? The galvanometer, okay? The galvanometer. What is the measurement of a known value call that checks for the reliability of a testing system? Your liquid controls or quality control? Quality control or a liquid control is a known value that checks the reliability of whatever testing system you are using. What is the measurement of the optics and or settings to ensure the analyzer is working correctly with the testing reagents called? Calibration. Remember, we review the manufacturer instructions that come with every kit or instrument we are using, and we follow their guidelines for both calibration and maintenance. And we remember we follow CLIA's laws and rules and regulations on how often we run controls. Remember, CLIA says we run 2 levels of control every 8 hours of a shift anytime patient testing is done. So you want to be able to identify the panel given for these specific tests. So a T3, a T4, and a TSH, what panel is that? It's the thyroid panel, right? Troponin I and T and the enzyme CK and myoglobin. A cardiac panel. Positively charged cations and negatively charged ions. That's your electrolyte panel. Sodium, potassium chloride, and bicarbonate. Your BUN, creatinine, uric acid, and electrolytes make up what panel? Your renal panel. Bilirubin, albumin, ALP, GGT, AST, ALT, and LD. What panel do they make up? Your liver panel or hepatic panel. How long should the following be allowed to clot before spinning it down? Now, I'm going to go through each one of these. Slowly pause these, okay, and make sure you're getting the right number. Study these and make sure you know. What is the normal for each one of these tests? Again, I'm not going to read them off. I know you guys can read, but I want you to have these slides so that you can use them as a study tool. So pause each one of the tests, write down the answer to make sure you're getting the right answers. Okay, guys, now that we have reviewed and done some review questions that you guys can use to study for Chapter 6 on chemistry, let's move forward. Okay, so you can put that piece of paper aside and you can go back later and do those review questions again if you like, just to use it as a study tool. But on 180 in our textbook starts Chapter 7. And just like on this screen, at the top of Chapter 7 is our learning objectives. These are the things that after you finish reading Chapter 7 in your textbook, which you should have already done, and we go through these PowerPoint presentations, you fill out your study guides, and then you study those study guides. These are the things at the end of that session that you should know. And they're everything from explaining the immune process all the way down to understanding and explaining how titers are used by physicians and all the stuff in between. So here are some key terms that you guys need to know. I'm going to go through these quickly, but you can use these as a way to study. You can pause them and get a piece of paper out and test yourself to see if you're getting the right answer. All your key terms are located in your textbook on 180 and 181. Make sure you know these key terms. It's very important to understand the terms for this particular chapter, all chapters, so that you can speak intelligently to your co-workers and to your patients, and so that you will truly understand immunology. Okay, guys, like I said, your key terms are located on page 180 and 181 in your textbook. It is in healthcare, it's vitally important that we understand our terms, okay? So we're going to start off with just an overview of immunology with just some fundamental concepts. This will not be the first time you've heard a lot of this, as you guys have taken other classes dealing with healthcare, things like anatomy and physiology. We understand that our immune system really protects us, right? It's our defense system. And it protects us against things like viruses and cancer, things like either toxins or pollution that can be in the water, in the air, in the soil, germs, funguses, parasites, all those things out there that can make us sick or give us a disease. This is what our immune system's job is all about, and that's what immunology is about. So we want to talk about that antigen antibody thing, okay? So we understand that an antigen is a substance that when it's when it comes into our body, it induces an antibody response, okay? All right, so we understand that a substance such as bacteria or cancers or any of those things listed are perceived as foreign to our body, right? And when it comes in and our body sees it as foreign, a protein produced after the body detects the presence of that antigen. So what happens is this foreign substance comes in, like, and this will later on we'll talk about this is how vaccines work. We're exposed to that antigen, we build up an antibody to it, and then the next time we see it, that antibody's job is to go out and attack it before it can make us sick, right? That's pretty much what it boils down to. And there's a lot of great information in your textbook on that antigen-antibody response. But in the end, in a simple terms, those substances come into your body sees it as foreign, it produces an antibody to that specific antigen, so that the next time your body comes in contact with it again, your body will have a defense to go out there and attack it and kill it before it can make you sick. Okay? That's a simplistic look at it, but that's where we're going to get started. Okay? So how exactly do antibodies work? They are specific for each antigen. Okay, that's the first thing that we need to know. They attack the antigen by forming what is known as an antigen-antibody complex. Okay, and they destroy, or they can render that invader harmless by agglutination, which is clumping, or lysing it, which is destroying it. You want to be able to describe in your own words how antibodies work to protect our bodies from foreign invaders like viruses, bacteria, cancers, and stuff like that. Make sure when you answer this for your homework or when you write it down so that you'll know how to put these things in your own words and you understand it, that you say that antibodies are specific to antigens, okay? Substances bodies view as foreign, right? We know the antigen is what our body sees as a foreign invader, and antibodies are what our body makes as a response to that. They attach to and try to destroy that antigen. Now let's talk about immunology testing and how it works. Okay, the testing use the fact that specific antibodies will attach to specific antigens, and they use that technique to detect the presence in the blood and or body fluids, okay, by using these antigen-antibody testing, and it is a really rapidly expanding laboratory science. And we call that laboratory science immunology. So what is an antigen? Okay, guys, I want to stop right here and make sure we think and check through what we've already been through to make sure we're learning this. So what is our antigen? Remember, that's a substance the body detects as foreign. And it can be lots of things, right? Be pollen this time of the year, right? Give me some examples. I want you to be able to not only identify what an antigen is, but I want you to be able to give me some examples. So what are examples? We've talked about these, right? Allergens, toxins, cancer cells, viruses, bacteria. And then, of course, when we're talking about antigen and antibody reactions, what is the antibody? A substance produced by the immune system to destroy specific antigens. When anything comes into our body that our body perceives as to be foreign, then it will build antibodies against it and attack it. That can be great when our body is defending us against things like viruses and bacteria, but sometimes in other cases, and we're going to go over this, it's not so great. So let's give some examples of antibodies. We understand that it's some examples. If I'm giving an example, it's an antibody against a specific bacteria or virus or toxin, right? So what is the name of the section of the lab that those antigen and antibody tests go to? Okay, so if we draw an antigen or antibody test, we're going to take those certain tests to immunology and or serology, okay? Immunology comes from the immunoglobulins, and serology comes from the serum because antibodies are found in the serum. So let's do a little case study here. Let's pretend that Sheila Thompson is a patient that comes into our clinic. She was given a TB skin test. The skin test came back positive, but when an X-ray was taken, no TB infection was present. It was determined that Sheila was allergic to rabbits, and the TB bacteria in the skin test was suspended in rabbit serum. What are two antigens described in this scenario? And remember, as you're trying to answer this, remember an antigen is something the body detects as foreign. So you guys could pause this real quick and take a chance to see if you can get the answer right. So the two antigens described in this scenario are first TB, right? TB is a foreign antigen that comes into our body, a microbacterium that can make us sick, and we will build antibodies up against it. Another thing is rabbit serum. That rabbit serum is not human, right? So when they injected that rabbit serum into her body, she had an allergic reaction to it. So the two antigens we're talking about are TB and rabbit serum. What antibody was not present and what antibody was present? So pause this and really try to think this through, critically think through this to see if you get the right answer. Okay, so since the TB test came back negative, there was no TB bacteria present. Since she was allergic to rabbits, she had the antibody to rabbits. So the thing is, she did have a positive TB skin test, but her x-ray proved that she did not have TB. So when they went to look, what else did we inject into her that could have caused an antigen-antibody reaction? Well, they knew that that TB was suspended in rabbit serum, so then they tested her to see if she was allergic to rabbit serum, and she was, so that explains the positive TB test, but it also explains why her x-ray was negative for TB. So what is the name of the laboratory department that performs antigen antibodies tests? Guys, it's real important to take a minute, stop, and make sure that as we're going through this process, that each and every time we're learning this stuff, okay? So make sure you pause this and see if you get the right answer. Remember, immunology or serology is the department in the lab that we take these antigen antibody testings to be tested. What happens when antibodies and antigens come in contact with each other? They form that antigen-antibody complex, and the antibody tries to destroy the antigen by either agglutination or lysis. So, moving forward, and I know y'all can see the way I'm going with this, now we're going to move and talk about vaccination or immunization, okay? We know that the process of injecting harmless or killed microorganisms into the body to induce immunity, which would be antibody production against a potential pathogen. Okay? This is what vaccination and or immunization is about. We take a harmless or killed microorganism, such as the COVID-19 virus, we inject it into your body, forcing your body to induce an immune response to it and produce antibodies, so that then in turn, when your body comes in contact with the COVID virus again, it will attack it and agglutinate or lyse it so you will not get sick from COVID. Okay? Immunization makes the body produce the antibodies against the substance in the vaccination. Whether it's measles, mumps, rubella, chickenpox, COVID-19, the flu, okay? For example, if killed flu germs were injected, the person would form immunity or antibodies against the flu. I know what a lot of you are saying. Why plenty of times people get the flu shot and they still get the flu. Okay, it's a twofold problem. Either they had already been exposed to the flu immediately prior to them getting their flu shot and didn't even know it, so they were already exposed and were getting sick from the flu right before they got their flu shot and didn't know it. Or they, how do I want to word this? Or they, I know y'all have heard this, each and every year they struggle because viruses mutate. We hear in the news about the COVID-19 variants. Variants in viruses is very common. And the issue with the flu is that we're predicting as best we can each year which flu we think is going to be the big flu for the season. And then we produce that vaccine and we give it to people. Now, like I said, one way is that you really were exposed to the flu prior to getting your flu shot, and you're really about to get sick and you don't even know it. You get your flu shot and you get sick anyway because of the timing of it. Or you come in contact with a flu that you weren't vaccinated for, okay? So they vaccinated you for a certain variant of influenza, but you come in contact with a person who is sick with a different variant of influenza. So your body doesn't have the antibodies for that specific influenza variant. So then you end up getting sick anyway, okay? So that's two of those things that would cause people to say, I got the vaccine and I still got sick anyway, okay? Now, let's talk about autoimmune diseases. What are autoimmune diseases? I know y'all have heard this. A lot of you know a lot about it. Some of you may even have some autoimmune diseases or have some people in your family that do. A disease in which the body produces antibodies that attack their own body's tissues or self-antigens. That's like I talked about earlier, that our immune system is a great thing and it's really wonderful. It can protect us, but sometimes it can go off. That's why we call it a dis-ease, right? A disease. It can go off and it can cause harm instead of causing good, okay? So make sure you understand how that vaccination or immunization works, and make sure you understand what an autoimmune disease is. So now let's talk about things. We have multiple layers of defense, right? And our first line of defense is our natural barriers, okay? The overall immune process that occurs as the body protects itself is viewed in 3 lines of defense, okay? So that first line of defense is those non-specific natural barriers that stop invaders from entering in or growing on the skin and the mucous membranes. So now we're going to talk about some examples of how that first line of defense works. First, let's talk about our skin, right? Our skin is a first line of defense that helps protect us and keep things like pollens, toxins, and viruses and bacteria out of our body so that we don't get sick. Things like mucous membranes, right? Our mucous membranes protect us, that the hair inside your nose and the mucus that's inside your nose can trap those irritants and allergens and pollen and stuff, and then you sneeze and get it out of there, and that's your first line of defense that keeps it from getting in your body and making you sick, right? They also secrete chemicals that maintain an acid pH of around 5.6, and that's to discourage the growth of pathogenic bacteria while allowing the growth of our normal flora. Like I said, mucus entraps those foreign organisms, and we can cough and sneeze and get those invaders out of our body. That's why we make sure that we either cover our mouth with a tissue that we then throw away, or we sneeze into our elbow so that we don't spray that cough and sneeze out all over everybody and surfaces, so that we transfer that bacteria or virus from one person to another. So let's say we have a Miss White comes into our doctor's office. She's a 32-year-old female. She was exposed to pneumonia. She started coughing and sneezing. She went to her doctor because she didn't feel well, right? So I want you to name 2 natural anatomic barriers that are in the first line of defense that she showed. Coughing and sneezing, right? Coughing and sneezing is our body's way of trying to get that stuff that is now in our throat. We breathed it in, or we breathed it in our nose. We're trying to get it out. That's the first line of defense to prevent that virus or bacteria from making us sick. Tell one way her skin and mucous membranes keep the pathogenic bacteria from growing while allowing the growth of our normal flora that we need to stay healthy. maintaining that acid pH of approximately 5.6. What protective role does her mucus play? And what protective role does coughing and sneezing play? Guys, we want to go over this quickly so we can start to lock the things that you're learning in. The way that we learn is to go over and over things. So we just went over this so you guys can pause this and see if you're getting the right answers. Remember that mucus entraps those foreign objects. That's why we get a stuffy nose and things in our nose, right? We have to blow our nose. Coughing and sneezing also helps move the foreign organisms from inside our throat or inside our nose out, right? What is the antigen in this case? What happens when an antigens and antibodies come in contact with one another? Remember, pneumonia was the antigen. That was the foreign invader, right? And then when it comes into your body, okay, they form an antigen-antibody complex, and the antibody tries to destroy the antigen by agglutination or lysis. So now let's move on to our second line of defense, okay? The non-specific internal response that occurs when invaders pass the first line of defense, it is generally seen within the first 12 hours of infection. Okay, so you're exposed to pneumonia or you're exposed to COVID-19, right? The first thing your body's going to try to do, that first line of defense, is by your skin or your mucous membranes or coughing or sneezing. It's going to try to get that virus or bacteria out of your body. And we know sometimes our body gets overwhelmed and it is unable to get all of that virus or bacteria out of our body. And once it's unable to do that with the first line of defense, in about 12 hours from being infected with it, now it's up to that second line of defense to see what they can do to stop us from getting sicker. So we're going to give 3 examples of how the second line of defense works. First, we know that when we get an infection, our WBCs are involved in fighting that infection, both viral, okay, and bacterial. WBCs can engulf and or destroy the invaders. Neutrophils engulf and ingest the invaders by phagocytosis. Monocytes, we've talked about this before, they're able to leave the bloodstream, and as they do, they become macrophages in the tissue, and they can ingest the invader by phagocytosis. Then there's special lymphocytes called natural killer cells, or T8 cells, attack and destroy the body's infected cells and cancer cells in a non-specific way. And guys, there's a lot of great information in your textbook on page 182 and 183 about these different types of cells, okay? So again, I always like to stop when we go over something and for you to test yourself and see if you're starting to remember this. So again, you can use these thinking slides as a way for you to study. So we want to name 3 white blood cells involved in that second line of defense. So we know neutrophils, monocytes, and lymphocytes. So what do the monocytes turn into when they leave the bloodstream and go into the tissues? Phagocytes, right? Macrophages, right? And they kill that invaders by phagocytosis, okay? So how do they stop foreign invaders? By phagocytosis, right? Are they specific or non-specific? Non-specific. They will gobble up any type of bacteria, virus, or cancer cells. Okay? Only the third line of defense is specific. No matter if pneumonia or the flu or COVID-19 or pollen or an allergen or a toxin goes into your nose, if it is foreign to your body, your mucus is going to try to trap it, and it's going to induce you to sneeze or cough to try to get it out of your body. It's not going to care what kind of toxics or allergen or bacteria or virus it is. It's not specific. It just knows that's foreign and it wants to get it out of your body to help defend you. Okay? And in the second line of defense, that's the first line of defense, right? Your skin, your mucous membranes. Your second line of defense, these cells just know it's foreign to them, okay? They're just going to gobble up any type of the bacteria and virus. Only that third line of defense is going to be specific to certain things. So we're still talking about that second line of defense, okay? Two types of protective proteins become involved in the second line of defense. Interferon is protein secreted by the infected cells to prevent their further replication and the spread of the infection into neighboring cells. Interferon interferes with the spread of infections. So when the cells get infected with the bacteria, virus, or parasite, interferon is a protein that cell secretes so that they can't just keep making cells over and over again or jumping from one cell to the next, okay? And then there's complement proteins, proteins that further stimulate phagocytosis and inflammation and are capable of destroying bacteria by punching holes in their membranes, causing them to fill up with fluid, and then they explode. So remember, there's two in that second line of defense, protective proteins that become involved in that non-specific internal response to an invader, interferon and complement proteins. So I want you to be able to name the two protective proteins in the second line of defense. Use these thinking slides as a way to study. Okay, so now we're still talking about that second line of defense. You can see that when we talked about earlier, it causes inflammation, right? The inflammation response is then initiated. Now, inflammation, we see that as a bad thing, and it can be, but it's also a defense mechanism. And, you know, sometimes some of the defense hurts, right? It's our body's way of destroying that invader and getting it out of our body, and hopefully in the meantime, not doing too much damage to us, right? So inflammation shows itself in if you got an inflamed area, it's hot in that area, it may get red, some swelling and may occur in the area, you're going to have some pain. Histamines are released by that injured cell, causing your blood vessels to dilate, which increases blood flow to that infected area, which is resulting in that redness and heat. And then fluids in the plasma leak into the tissue because of the increased permeability of those vessels, causing that swelling or pain. So you need to understand heat, redness, swelling, and pain are all things that are caused by inflammation. And we need to understand that this is why. This is what causes the heat. This is what causes the redness, the swelling, and the pain, okay? Okay, guys, let's use these thinking slides as a way to study. So what is the name of the response in the second line of defense that causes heat, redness, swelling, and pain? Inflammation, right? What is it, specific or non-specific? It's non-specific, right? Because only the third line of defense is specific. Remember when we did our SED rate, our Westergen SEDiplast system SED rate, when we did that in the labs, hands-on, we set up those SED rates. I talked to y'all then about the fact that those SED rates are not going to tell you what's causing the inflammation. They're just going to tell you if you have inflammation, okay? Just non-specific inflammation. Because inflammation can occur with many different disease states. It's not specific to any one. You could have rheumatoid arthritis, you could have a viral infection, bacterial infection, you could have lupus, all of these things, autoimmune diseases, diseases, and viruses, bacteria can all cause inflammation, but it is non-specific. So let's do a little case study here. So Mr. Don Mack, a 51-year-old male, presented to his doctor with a high fever, a headache, sore throat, coughing and sneezing, body aches, and a runny nose. The doctor ordered a CBC. The results showed a very low WBC count and increased lymphocytes on the differential. What do you think the diagnosis will be? Now, I've talked to you guys before in our hematology section about the white blood cell count and about increased lymphocytes on the differential. So use what you've learned in hematology in both lab and lecture and what I'm talking to you about now. Pause this and see if you can guess what the diagnosis will be. Viral, right? Because when we have a low WBC count and an increased lymphocytes, along with their signs and symptoms, a lot of times that is going to pinpoint that physician that they have a viral infection, such as the flu, versus a bacterial infection. So be able to pause this and be able to name the 3 WBCs that would play a role in the second line of defense. Be able to name 2 protective proteins that would play a role in the second line of defense. And what is the name of the response in the second line of defense that causes heat, redness, swelling, and pain? Is the second line of defense specific or non-specific? Remember, only the third line of defense is specific. So now, since we've talked about that first line of defense, the second line of defense, and we keep saying that neither the first or the second is specific, let's move on to that third line of defense that is specific. Okay? Adaptive or acquired immunity. Intelligent identification of the invader based on its antigenic properties. A specific antibody is made for a specific antigen. For example, the antibody to strep does not work against pneumonia. When your body comes, once we get to this third line of defense, it's that intelligent defense, right? And it's going to make an antibody that is just specific to strep, okay? But how does that third line of defense work? So we have T cells and B cells, and they work together specifically to destroy the invaders or render it harmless. They're also capable of developing memory so that a second encounter with the same organism will induce a heightened and quicker immune reaction. T cells or T lymphocytes provide cell-mediated immunity, okay? Of the lymphocytes circulating in the blood, 70 to 80% are T cells. T cells become involved at the site of invasion where they are activated after they receive an antigen presentation from macrophages. One activated T cell rapidly duplicates themselves into clones that differentiate into 4 different subgroups. And guys, there are a lot of great pictures, okay? A lot of great information in your textbook on the first line of defense, second line of defense, and the third line of defense on page 182 and 183 of your textbook, okay? Okay, when we talked about 4 different subgroups, one of the first one we're going to talk about is killer T cells or cytotoxin cells, okay? There's lots of names for them. They're an antigen-activated lymphocyte that attacks foreign antigens directly and destroys cells that bear that antigens or bear those antigens, okay? And when you're studying, think about little 8-year-olds like to tear things up or kill things, right? So killer T cells. These other things, TC, T8 cells, or cytotoxins are all just another name for the killer T cells. They directly attack those foreign antigens and destroy the cells that bear that specific antigen, okay? Then, like I said, there's 4. The second one is helper T cells, or TH4 or CD4. Okay, there's lots of different names. they stimulate other T cells and stimulate B cells to produce their antibodies. Okay? Now, these are the cells that can become infected and destroyed by the human immunodeficiency virus HIV. Okay? So, remember, these helper T cells, or T4, TH4, or CD4 cells, these are the ones that stimulate other T cells and help B cells produce antibodies. Okay? Now, the study tip is T4, TH4, CD4, 4-year-olds like to help, right? So killer T cells, T8 cells, you think of little 8-year-olds like to tear up things. Think of little 4-year-olds that always like to help you, like to cook and stuff, right? Now that was the first two. Now here's the other two. Suppressor T cells, or TS cells. They inhibit T and B cells after enough cells have been activated. Because like most things in our body, right, when we talk about coagulation cascade, we need to start the coagulation process and stop the bleed, but we also don't want to just continue to clot, right? And it's just like this third line of defense. We need to make enough T cells and B cells to take care of the problem, but once we have enough cells, we don't want them to just keep going and going and going and going. So the suppressor T cells' job is at the correct time to inhibit this process, okay? Then we have memory T cells. They remember the antigen for future encounters, okay? Just like the name says, memory. They remember that antigen so that the next time they come in contact with that specific antigen, they're ready to respond to subsequent exposures to the specific antigens with increased speed and intensity to try to decrease the chances of you becoming ill, okay? So I want you to get out a piece of paper, if you still have that one piece of paper, and I want you to go through these. I'm not going to read them to you because I know you guys can read. I want you to be able to use these slides as a way to study, okay? So you just pause this and then write your answer down. Start it again. I'm going to give you time to pause as each question pops up, and I want you to see if you're getting the answer to these questions right. So pause it now. Once you get through with this slide, go back and check and make sure you've gotten the right answers. Okay, you guys ready? So hopefully you have answered all those questions. If you need to pause this and go back to it, you can. But I want you to then see if you're getting these questions right. The T cells and B cells are the two main types of lymphocytes involved in that third line of defense. T cells. T cells are the lymphocytes involved in cell-mediated immunity. Remember, killer cells, helper cells, suppressor cells, and memory cells. Remember, T8 cell, right? There's a lot of different names, but T8 cell is also another name for the killer T cells or the cytotoxin cells. So here's a little activity I want you guys to try to do, because what I'm trying to make you do as medical assistants, lab assistants, phlebotomists, I want you to be able to take the things you're learning in both lab and lecture and be able to put them together and be able to apply them to situations that you may run into out in the field. So if a person with AIDS has a low T4 count, would this affect the T cells, B cells, or both? So pause this and write down your answer and then start it up again to see if you are thinking this through correctly and you're getting the right answer. Both, right? Because they not only help with the production of more T cells, but they also help with the production of B cells. T cells are the helper cells, right? They not only stimulate other T cells, but they help B cells to produce antibodies. So when you have a low T4 cells, a T4 count, then you don't have enough to stimulate other T cells, and you don't have enough to help B cells produce their antibodies. Okay, guys, we're still on that third line of defense. Let's start Let's start talking about B cells or B lymphocytes, okay? And again, this is on page 183 in your textbook. I hope you've already read that chapter before you started reading this and filling out your study guides in your black binder. But B cells or B lymphocytes provide humoral immunity or antibody-mediated immunity. This immunity begins with the interaction of a B cell with a specific antigen and the lymphocyte, or a small piece of antigen, okay, from the T helper cell. Once it is activated, B cells rapidly duplicate into a clone and are differentiated into two subgroups. Remember, the body's fluids are in humors. And so remember, this B cells and B lymphocytes provide humoral immunity or antibody-mediated immunity, okay? Okay, guys, those two different subgroups of those B cells are plasma cells and memory B cells, okay? There is a great illustration on page 183 of your textbook. It's figure 7.3. Remember, the activation of the B cells by antigens and the T helper cells resulting in humoral antibody immunity. This is a three-step process that results in the production of antibodies by the plasma cells, okay? And if you'll see in that illustration, you see that formation of a clone that produces those plasma cells that secrete antibodies and those memory B cells that remember the antigen for future encounters. So just to go over this again, these are those two subgroups, right? So the plasma cells, they produce the antibodies, okay? Immunoglobulins, right? That travel through the blood specifically targeting and reacting with the antigens, resulting in the destruction of that invader, right? And then those memory B cells, they remember the antigen for future encounters when you come in contact with that virus, bacteria, toxin, whatever again. They're also ready to respond in the next exposure to that specific antigen with greater speed and intensity. So again, here's one of our thinking slides, right? What are the two main types of lymphocytes involved in immunity? T cells and B cells, right? What cells are involved in cell-mediated immunity? T cells, right? And what cells are involved in humoral or antibody-mediated immunity? We know that's our B cells, right? So we see that we have two types of lymphocytes that are involved in immunity, T cells and B cells. We know that cell-mediated immunity involves our T cells, and the humoral or antibody-mediated immunity involves the B cells. Is the third line of defense specific or non-specific, and what does that mean? This is a very important question that you guys need to lock in. We'll talk about it in the classroom as well, but you need to understand this. It's specific, right? We talked about our three lines of defense. First line of defense, second line of defense. They are not specific. They will attack any foreign invader and try to destroy it, from a virus to a fungus to whatever. But if it gets past our first two lines of defense, then our third line of defense has a specific defense to that specific antigen or that specific virus or pollutant, right? So what are the four subgroups of the T cells? Killer, helper, suppressor, and memory cells. What are the two subgroups of B cells? The plasma and the memory cells. Which of the subgroups are the same for both groups? Memory cells. Both T cells and B cells produce memory cells. Because we need that's the thing with immunity, right, guys? We come in contact and we want to have immunity so that the next time that we see that specific antigen, our body can make a quick job of trying to destroy it. So we need as many memory cells as we can. So that's why both T cells and B cells produce those cells. So Miss Williams comes into our doctor's office. She says she has a headache. She's tired, weak, nausea and congestion, pain, tenderness, and swelling over her sinuses. She has a low-grade fever. The doctor orders a CBC, which shows a moderate increase in her WBCs and an increase in her neutrophils. What type of infection does she most likely have, bacterial or viral? Bacterial. There is a moderate increase in the WBCs and an increase in neutrophils. Earlier, we talked about how a lower white count and an increase in lymphocytes would tell us we had a virus. We understand, or, with the symptoms and all that could show the doctor that we had a viral infection. A moderate increase in the WBCs and an increase in neutrophils can lead us towards a bacterial. So I want you to be able to name the two main types of lymphocytes that have been activated by this illness. T cells and B cells, right? Which of these groups produce plasma cells? B cells, right? Remember that nice figure on page 183 in your textbook, 7.3. It's a really good, not only does it explain it to go along with this companion video, but it also gives you a really nice illustration to show you how this whole process works. What is the name of the substance produced by plasma cells that travels through the blood to specifically target the antigens? Antibodies, right? What is the antigen in this case that we're talking about? The bacteria that's causing the infection, right? What are the 4 types of T cells? Remember, killer, helper, suppressor, and memory. Use these slides as a way to study. You can pause them and then write down your answers, start them back up, and see if you're getting them right. Okay, as always, we need to be able, as a healthcare professional, to be able to describe in our own words the difference between nonspecific and specific defense mechanism the body has in defending itself, including how the first, second, and third lines of defense works. And on my test sometimes on the back on the gray area, I'm going to get you to write in your own words. So this is a place where you need to write this down, and then you need to be able to intelligently be able to write down in your own words what this is about, because what it proves is that you fully understand how this works. Okay? Okay, guys, you want to make sure that your answer contains these things. These are the things that you need to understand, and then you will be able to write them down in your own words. You need to know that nonspecific defense mechanisms work against all foreign substances in the same way, and that specific defense mechanisms only work against the foreign invader that they were formed to work against. If any kind of allergen or pollen or bacteria gets in your mucous membranes in your nose or throat, it may cause you to sneeze. It's going to sneeze them all out. It's not specific to one, right? But if you get a vaccine against chickenpox, that's not going to work against smallpox, okay? So that's the difference between non-specific and specific. Make sure you know that. Make sure you understand what your first line of defense is. Make sure you understand what your second line of defense is. Remember, those neutrophils will engulf all bacteria, whether it's a pneumonia or something else. It doesn't matter. It's not specific to it, right? And remember, you understand that the WBCs that work in our second line defense are neutrophils, monocytes, and lymphocytes, and that plasma proteins, both interferon and complement, work as well, along with inflammation, and they're all non-specific. Make sure you understand about your third line of defense, that you have T cells, right? Whether it's killer, helper, suppressor, or memory. And that B cells, both plasma and memory, work specifically against a certain antigen. Okay, guys, this wraps up the first half of Chapter 7 on immunology. Okay, I'll be placing this on Canvas so you guys can read Chapter 7 in your textbook, have your black binder out, fill out your study guides just like you would do in the classroom during lecture, and then study those study guides. I will be getting that second half to the Chapter 7 up shortly. You guys have a great day.